Disorders of menstruation today we'll see. So this is the last topic in this unit. Disorders of menstruation. This the first condition is amenorrhea. So what is amenorrhea? I told you no A. You already know that A means absence. So menarche. So absence of menstruation is known as amenorrhea. So mostly in the when we call it as amenorrhea ante the woman should be in the reproductive age group. So after reproductive age group, that means after 45 or 50, if they are getting amenorrhea ante, that is one of the condition known as menopause. Okay. So after this unit we will see menopause. Because menstrual cycle we have seen, and problems of menstruation we will see. Last thing we will see the menopause also after this class. So absence of menstruation is in reproductive age group is known as amenorrhea. So after the reproductive age group it is called as menopause. You keep it in your mind. So classification of amenorrhea, we have two types of classification. So physiological classification and pathological. So physiological includes pre-puberty, pregnancy related, menopause. Already pregnancy, if a woman got pregnancy ante, they will not get any periods, monthly periods up to 9 months, up to after the delivery they will not get the, that is also one of the physiological condition that a woman will not get the amenorrhea. Okay, will get amenorrhea. And pathological primary secondary we have. Okay, so cryptomenorrhea, it is menstruation occur but there is obstruction to the outflow of the bed. Causes, it is because of the cryptomenorrhea is nothing but it is obstruction of the menstrual cycle. See, this is one of the condition. Okay, so why it is amenorrhea, it is one of the condition. Okay, ఎందుకు వాళ్ళకి why they are not getting periods అంటే because of cryptomenarche. Cryptomenarche means outflow of the menstrual cycle is normal. Okay, but something is obstruction to come out the blood. Okay, during in the vaginal area or any cervical area, it may be the problem. Vaginal arteriasis అంటే that opening may be closed, or cervical stenosis inside this cervix, the it may be closed. So that is a main reason for the cryptomenorrhea. So what are the pathophysiology? Accumulation of blood in uterine cavity. So hematocolps, hematometra, hematosalpinx. So these are the pathophysiology, because after due to unobstruction of the blood flow, so inside blood flow will be more, that is all or infected blood, it is coming to a blood clot, hematoclops. After that it becomes a hematometra, and after that it becomes hematosalpinx. That means salpinge and pharynx, area of fallopian tubes, everything will be involved and everything will be filled with the blood. So what are clinical features? Mostly amenorrhea, no bleeding will be seen, abdominal pain, retention of urine, uniform globular mass in the abdomen, bulging of hymen you can see. So because of inside pressure there will be hymen layer, it is a one of the thin layer in the vaginal area. So cruciate insertion of hymen and drainage of, so what may be, if it is problem related to the hymen layer, so we can remove the hymen layer so that the blood will come out. So dilatation of cervix can be seen with the help of, if it is a stenosis, nothing but dilatation can be done. So one tube, one rubber, like rubber band, it will be, they will insert it so that it will open the cervical opening. So failure primary amenorrhea, we have causes no two amenorrhea, primary and the secondary. So primary amenorrhea includes failure of onset of menstruation beyond the age 16 in a girl with normal secondary characters. So what happened, it is some girls will get late period, okay, but everything is normal. So secondary sexual characters under breast increasing and axillary hair, pubic hair, everything will come, but menarche will not come. Okay, that is primary amenorrhea. Causes, it is because of mainly hormone problem. So delayed puberty, so hypogonadism we call it as delayed puberty, sometimes tumors, sometimes hypothalamic, because hypothalamus is the main gland that will gives the hormones, so that may affect in the pituitary and the hypothalamus, so that may be problems. And primary ovarian follicle galactosemia, that means sugar patients, and sometimes abnormal chromosome pattern also will get the primary amenorrhea. So developmental defect of genital, that means absence of vagina, absence of uterus, sometimes they may be thyroid problems, metabolic problems, these all can be seen. So histamic examinations, investigations you can do. So history and physical examination, ultrasonography, karyotyping, hormonal studies, blood investigation we can do. So management part, mostly correction of the causes we have to see, because there are many big causes out there, that is surgical correction should be there, and estrogen and progesterone should be given, corticosteroid therapy can be given for the patients. So what is secondary menorrhea? Absence of menstruation for 6 months or more in a woman with a previous normal menstrual pattern. That means already they got first menarche, menstrual period. After that, if 6 months they are not getting ante, then it is known as secondary amenorrhea. What is etiological condition for secondary amenorrhea? It is because of uterine problems, ovarian problems, hormonal problems, that means pituitary and hypothalamic and systemic, and some adrenal gland disorders also will leads to the secondary amenorrhea. So investigations, history and physical examination, so blood investigations and the hormonal studies can be done during these things. So management, actually no abnormalities detected. So cases with abnormalities detected, that is uterine problems, and it can be corrected. And polycystic PCOD, nowadays each and every woman, 90% of women are suffering with PCODs, so polycystic ovarian disease. So for mostly polycystic ovarian disease, the weight is the main problem. So we have to reduce the weight, and we have to, any pituitary hormonal balance is there, that you have to correct it to manage the secondary amenorrhea. Or you can take a brocroptin or any surgery, and premature ovarian follicle, hormonal therapy, corticosteroid drugs, so these can be treated. And adrenal disorders, adreno corticolytic drugs should be given, or if anything more serious, and you can remove the adrenal glands which are present above the kidneys. And this is the main first condition, that is cryptomegaria we have seen, and also the amenorrhea we have seen. Now second condition is dysmenorrhea. So what is dysmenorrhea? Every woman will get during menstrual cycle, the woman will have pain in the abdomen. So painful cramping during menstruation is called as dysmenorrhea. What is classification? Primary dysmenorrhea and the secondary dysmenorrhea. So primary dysmenorrhea and the secondary dysmenorrhea. So spasmodic, conjunctive, membranous. Other types we have spasmodic, conjunctive and membranous. So there are three types of painful in the abdomen. Spasmodic means only contractions. Conjunctive means something is, a whole abdomen will be involved. And membranous means something deep, it will get your pain, just I am dying, like that the pain will come. So primary dysmenorrhea, this is a painful menstruation without not serious problems or any other related problems like pelvic pathology. So usually starts 3 to 3 years after menarche, and ceases after childbirth. Being begins shortly before or on the onset of menses and lasts 1 or 3 days. And causes psychomatic factors, abnormal anatomical functions of uterus, stenosis at internal os, unequal development of Mullerian duct, and inappropriate law of polarity, role of vasopressin. These are the hormones and physiological conditions inside. So prostaglandins mostly releases, so that cramping will be seen, uterine pressure will be seen, sometimes ischemia, lack of oxygen will be done to the uterus, so pain will come. So that's why what they'll do, they will go for a walk, or like that. If you go out and you see the greenery row, always if you eat glucose in the blood, it will supply more oxygen to the uterus, so pain will get reduced. And clinical features: uterine cramping, nausea, vomitings, fatigue, diarrhea, headache and giddiness will be seen. So diagnosis, how you will diagnose? So pelvic sonography can be done, CT MRI scan, hysterosalpingography. That salpinge means nothing but fallopian tubes, amma. So that can be taken picture, and hysteroscopy or laparoscopy can be done. So treatment, mostly counseling should be given, psychotherapy for support, and some analgesic should be given. So prostaglandins, that mefenic acid, ibuprofen, you'll get the meftalspas. This all can be taken. Oral contraceptives can be given. So surgery, if any problems related to cervical canal opening, that you can be dilated, and more deep pain ante you can this neurectomy. So pre-sacral neurectomy, that means if you cut the neurons to that uterine, so sensation will not be there, so pain will not get. So in last stage, if they are getting severe pain ante, they can do a pre-sacral neurectomy, laser assisted ultrasacral nerve ablation. That means at their nerves, no, they will do ablation, means nothing but they will burn the nerves so that they will be inactive. And secondary dysmenorrhea associate with presence of pelvic pathology. So first thing is no pelvic pathology, primary. Secondary means they have pelvic pathology. Cramping starts 3 to 5 days prior to the menstruation and relieves with start of bleeding. Patients are usually 13s. So chronic pelvic infections, endometriosis, adenomyosis, uterine fibroids, IUCD in utero, that means intrauterine device, and endometrial polyp should be there. So pathophysiology, pain in the pelvic congestion, which is more marked in the premenstrual period. Pain increases in its severity as menstruation approaches and relieved by onset of menstrual flow due to diminution of pelvic congestion. So dull aching, lower abdominal pain, dyspareunia, and difficulty in urination. Okay, infertility, abnormal bleeding can be seen. So what are the treatment? Treat the causes rather than symptoms. So surgical interventions means you have to do first hysterectomy, hysteroscopy and laparoscopy. Then if any adenomas or omas are find out, you have to remove that. If any elderly patients are having this omas ante, you can do complete hysterectomy, removal of complete uterus, you can see. This is about the disorders of menstruation, dysmenorrhea and cryptomenorrhea. Okay, so next class, by this now we have finished the first unit. So second unit, yeah, first unit not, this is second unit, puberty is finished, and next thing is we will see the last unit, menopause, and then we come to breast disorders. See, for your better understanding, I am dealing like this. So first we have seen the normal reproductive tract. Okay, then menarchal problems. Now we will see the after menarche, what is the problem. Then coming to breast, what are the problems. Then we will go to uh, discuss the disease conditions. Okay, so this tomorrow I will start the menopause.